It's bad news if you break a bone, but in breaking news, if you're older, a fracture of a fragile bone can have catastrophic consequences. Dr. Megan Brady is here to set us straight on how to beef up our bone health. Dr. Brady is with the Bone Fragility Clinic at Metro Health. Welcome to the show.
Thank you for having me.
Well, do we all lose bone during lifetime as we age?
We do. Everyone loses bone as they age, especially women, and that comes with menopause. And so it's a problem because a lot of people will lose bone and not know it. It's a silent disease, osteoporosis, and so it doesn't have markers like chest pain and whatnot with heart disease. And it's a problem because if someone that has poor bone falls, they're at higher risk for breaking a bone, and they're also at higher risk for having a more severe fracture pattern. So at Metro Health, we're actually trying to screen these patients and prevent fractures.
How big of a problem really is it?
It affects about 44 million Americans. 44 million Americans annually are diagnosed with osteoporosis, and 1.5 million Americans actually suffer a fracture because of their osteoporosis, so it's a huge scope.
Big problem. So if bone loss is a part of aging for everybody,
right,
are fragile bones just a foregone conclusion? You're just going to have them, or is there something you can do?
Well, at Metro Health, we're trying to promote exercise, actually. Exercise is a great way to keep your bones strong. You need to check with your doctor first, of course, if you haven't exercised, but I encourage all of my patients to do walking and low-impact weight exercises to cause bone remodeling.
Okay. It sounds like exercise is the thing to solve every kind of medical problem.
It definitely is.
A lot of doctors on this show, so everybody get up and exercise. Should we also be taking calcium or some other kind of supplement to help build up our bones?
Definitely. I recommend most patients take calcium, 1,200 milligrams at least, and 1,000 international units of vitamin D3. Most of us are not getting enough calcium and vitamin D in our diet, and we're not getting enough sunlight because we're busy people. We also live in Cleveland, so there's not enough sun to keep our vitamin D levels high.
Oh, well, this summer we've had a pretty nice summer.
Everyone get out there and enjoy the sun.
Yeah, we got to have our picnic, get out in the sun, get that vitamin D through the sun rather than having to always take it. What if we do have some fragile bones going and maybe some osteoporosis? Is there some kind of treatment that you need like right away? Is there something that you can do to help beef them up even at that point?
So that's our goal with the Metro Health Fragility Fracture Clinic for patients with fragile bones, is that we're trying to screen these patients in simple bone scans and some blood work that we can figure out what's causing the osteoporosis and intervene with some vitamin D replacement or whatnot. And also there's a lot of new medications that are really effective in treating osteoporosis. And so what type of medication depends on the severity of the disease, and we can definitely treat the disease to prevent further bone loss.
Okay, and so before we get to where we have further bone loss and have to have the medications, the exercise, are there any, you said walking before, anything else that's really valuable?
Walking, making sure you get enough calcium and vitamin D in your diet or with replacements, and then doing some weight-bearing exercise really makes a big difference in bone health.
What's weight-bearing? I know that I've been told that as well, and I was like, well, what is weight-bearing? Is it my weight enough, or do I have to lift weights? Or?
You know, I recommend people use even like 2-pound dumbbells and just do a few bicep curls a day, or even if you want to use cans of soup if you're elderly, whatever's available to you.
So just the arm lifting
exactly
stuff. And walking, that's enough body weight to be weight-bearing?
Definitely. Definitely.
Oh, all right, so we can prevent it.
Yep.
If it happens, there's still treatment.
Exactly.
So there's hope. All right, very interesting. Thank you so much. Keeping bones strong and healthy can keep you strong and healthy. So follow Dr. Brady's advice. And for more tips, use the information that's coming up next. My thanks to Dr. Brady for joining us today.
Find out more by clicking to www.metrohealth.org, or for your free information sheet on preventing bone loss, call Metro Health at 216-778-4131. Next, getting acquainted with the aquarium.